One of the things that I feel are very important is how we're going to continue to monitor COVID-19 and which indicators are important to look at from a public health perspective. There's one thing that's been very difficult also for the general public to assess the risk of COVID-19, how this has been changing since the beginning of the pandemic. And it's very important that we use the right indicators, for example, cases, hospitalizations, percent of people in intensive care, COVID-19 deaths, but also excess mortality. All of these indicators are very, very crucial to actually keep track of, to be able to really assess what is really, how COVID-19 will evolve over the coming months and the coming years. So one particular aspect there is, of course, that the testing regimes have been changing in a lot of countries, and we need to really find indicators which are kind of independent of the testing regimes. And this has been one of the major challenges, to find indicators which are robust over time. Some of those indicators are particularly hospitalizations, I believe, of COVID-19, hospitalizations in intensive care, and also excess mortality. These I find are actually very good to also compare between countries. Finally, an indicator that's also been a bit underused by some countries is COVID-19 in wastewater treatment, because that has a big advantage, of course, that it doesn't depend on the testing regime that is being used in the country. So also that, I believe, is a very important indicator to see how much COVID-19 is circulating. But of course, the hospitalizations are very important to monitor, because this shows the effect on the health system in general. This is particularly relevant now, of course, for the newly emerging variant like subtypes of Omicron, BA4 and BA5, which have starting to circulate now in Europe, started in Portugal initially, and now being seen in other countries. So all of these indicators, some countries are seeing quite a lot of cases, but luckily there's a few hospitalizations that are being seen, or an excess mortality in most countries currently. So it's very important that these indicators see that what the real impact of BA4 and BA5 will be in the coming months.